Good afternoon from Texas Healthcare Trustees. My name is Amy Eskew, President and CEO of THT, and I am once again, perhaps finally, joined by Cesar Lopez, Associate General Counsel of the Texas Hospital Association. So if you recall, today's episode will be our potentially final one, our final update, hopefully fingers crossed, of the 88th Texas State Legislature of the past legislative session. Barring anything out of left field from special session, but it seems like they have their marching orders and a pretty strict agenda. So wanted to spend some time today talking to Cesar, just getting his thoughts on how the session went. And also he put together a very helpful presentation and handouts, which will be shared with you all to provide a recap of some of the key activity that came out of this past legislative session. So Cesar, just starting out, in your thoughts, what's your brief summary, or just how do you think this session went for Texas hospitals?
Yeah, so again, thanks for having me, and hopefully, as I've said on every episode we've taped, hope these sessions are informational. It was an interesting session. I think I've said that in the past already. This was a very, very difficult session in a number of ways, not the least because, there's this sort of push out there, this sentiment within the public and as a result with the folks at the Capitol that's very sort of anti-hospital, anti-healthcare, anti-doctor, anti-clinician, anti-nurse. And so it's been very interesting to have to navigate that during the session. And I think we'll get into some of the bills that passed and some of the bills that didn't pass, but just kind of seeing how that resulted in potential legislation or actual legislation has been very, very interesting. So when we talk about bills, usually we talk about them in terms of the number of sessions it's going to take to pass a bill. So like, hey, I've got this really good idea to reform, healthcare insurance. Well, great, let's introduce it. Let's get people used to the idea. Let's put it out there. Let's get people talking, but there's no way it's going to pass the session. It may be a 2-session bill or a 3-session bill or a 4-session bill until you get enough sort of critical mass to where folks really get behind an idea and understand it and totally grasp it, and then you can kind of pass it through. Well, there were a number of bills that in kind of any other session that I've worked here at THA probably would have been multi-session bills that actually passed the first time around. Again, some of the stuff we knew were coming. We talked about stuff like physician non-competes, some of the things that we're doing with healthcare billing and insurance, and some that we didn't. But nevertheless, it was a very, very, very interesting session from the healthcare perspective. And on this first slide, just to give everyone an idea of just sort of the magnitude, the craziness of everything that was involved, I think I mentioned in prior months that when the bill filing deadline kind of opened, when it was back in November, when legislators were actually able to start filing bills, and they can do that in November, several weeks ahead of the actual start of the session, probably about 2 months before the actual start of the session. It was the busiest first bill filing day that I've seen in the 4 sessions I've been here at THA. Now, a lot of those bills were attempts by folks to kind of get out there and get the PR and sort of get the headlines and be the first one out of the gate with some of these issues, transgender care, some of those sort of hot button abortion type issues that we've been dealing with over the last couple of years now. And those are the bills that folks want to make that splash with. There's also a flurry of activity at the end of the bill filing window, so at the bill filing deadline when it closes. That was another probably record deadline, in that there were a number of bills filed, in the last 24 hours, that there was the ability to file those bills. And the difference with filing bills at the end of the window as opposed to the beginning of the window is you usually file bills at the end that you don't want to have, out there and don't want to get the PR and the headlines. So it's sort of the opposite. So the bill filing deadline is notorious for some of those sneak attacks on those bills that kind of come in under the radar that nobody really hears about. Again, are those attempts to make them multi-session bills, multi-session issues? Who knows? But I think this slide is just sort of evidence of the number of bills and just the vast amount of stuff that we were dealing with during session. 8,500 plus bills filed between the House and the Senate. That is a new record, probably by at least 1,000 bills, which is significant because remember, it's only a 140-day session. We only meet every other year. So it's not like these guys can just sit there and file bills during the off season. This was the first time that House bill numbers had ever gotten it up into the 5,000. So they'd never passed that 5,000 number threshold. So five, and then three numbers behind it. And so a lot of folks in the House were shocked to know that we had broken through that threshold. So yeah, 8,500 bills filed, just over 4,000 passed at the end of session at the end of May. Normally the success rate in passage is in the teens, so like the 15 to 18 range. This is a lot closer to 50% passage rate if these numbers are indeed true. And again, these are just numbers that we informally pulled up off of our tracking software, so there could be some discrepancy here, but if that is even close to being true, that is an incredible passage rate for bills filed during any Texas legislature. And then we at THA broke our own record in that we tracked just over 1,600, almost 1,650 bills this session. Now, as I mentioned back in January, February, we track these bills to just make sure that something isn't added to these bills or a bad bill, starts moving and we don't know about it. We probably really only put actual work into about, I would say maybe about 150, 200 of those bills. But nevertheless, we do read, we did read most, if not all of those 8,500 bills. We did track those 1,600 bills. We do keep the tabs on all of those bills to make sure that we're doing the best we can for all of our hospital members. And I'll be perfectly honest, and I'll sort of fall on the sword here. There's always something we miss. We'll get a call in August or September after a session, and somebody will say, hey, what are you doing on, such and such bill or this issue? And it turns out that we completely fell through the cracks and we completely missed it. It wasn't part of that 1,600 bills that we tracked. And so that's an inevitability that's going to happen. And so I'm just kind of waiting to see what is this session. It's usually not anything super major or consequential, thankfully, but it's still kind of a little bit of egg on our face. But I'll just perfectly admit that, it does happen. So if you guys see anything out there that, you need to bring to our attention, please let us know, because that's a lot of bills, 4,000 that were actually passed. So yeah, I think all in all, a fairly good session. I don't yet know what the governor is going to veto, if anything. We're still kind of in that veto window. I think he has another week and a half to decide what he wants to veto, but he is signing bills. We'll touch on some of those here in a minute. But yeah, just a unique session, let's put it that way.
And then just to give the audience a reminder, and maybe to quell some fears, can you just real briefly discuss what the special session is focused on?
Yeah, so session ended on May 29th, Memorial Day, as constitutionally required. I think session formally ended at about 6 p.m., give or take, Monday night on Memorial Day. The governor immediately called the first special session, and in calling that special session, he indicated that there's probably going to be multiple special sessions this year. What we have heard is that his big issue, the governor's big issue, is school vouchers, which again probably doesn't have anything to do with healthcare, but that's his big issue, and that he was planning on tackling that in a September special session. Now, again, regular session ended 6 p.m. on Monday. He immediately kicked off the first special session at 9 p.m. on Monday. So everyone had about a 2.5, 3-hour break. And the governor is able to determine what he wants to be considered within any given special session. So remember, special session can be up to, but no more than 30 days. So anywhere from 1 day to 30 days. And the governor gets to decide the topics and the legislative issues that are discussed during that particular special session. He can stack them one right after another. So during that first special session, his two issues were border security and property taxes. Again, assuming that we're going to get into school vouchers, that may be coming in the coming months. Who knows? Maybe he's going to wait until September. There's a theory that he's basically going to stack special sessions between now and September and just kind of keep them rolling to keep people in town. But who knows? So as of today, July 12th, we are currently in our first special session, but it has nothing to do with healthcare. We are not engaged in it. We're working on bills that pass. We're doing presentations like this, but we're not currently involved in special session. Hopefully that holds true through the end of the year, but who knows? So yeah, I would expect a few more special sessions to pop up, and let's just keep our fingers crossed that we in the healthcare industry are not involved in any of them.
Okay, well, let's go ahead and dive in. As I mentioned, you put together a very helpful presentation, almost a cheat sheet of key legislation that passed or did not pass during this session. So let's go ahead and turn the floor back over to you to review everything.
Yeah, and before I kick off, I very quickly, I'm going to touch on a number of issues. All of these slides are going to be made available to everybody. There's no way I can get through all of this in the time that we have here. That said, I want the members to keep in mind that there's a number of documents coming their way. One, THA is putting the final touches on what we call our end of session report. That should be released any day now. Again, we're sitting here June 12th. It should be out in the next couple of days, week at the latest. That is sort of our quick bite. This is what happened during session, play by play, the good, the bad, and the ugly, bills that passed, bills that failed, whatever happened, but just sort of giving a 30,000-foot overview of everything we did during session. So that should be out here mid-June. The other bigger and some would say more important document will be at the end of the summer. That's our health law manual. That is a usually 300 to 400 page PDF document that addresses every piece of legislation that passed that we think is going to affect hospitals in one way or another. So we don't even touch something that didn't pass. It's just going to be bills that actually passed that have to be operationalized or that hospitals need to know about. And we in the legal team try to, provide as quick but detailed summary of all of these bills that actually did pass, so that somebody at the hospital can take it, open the page up to that bill, and know right away in a couple of minutes, if not a couple of seconds, this is what that bill says, this is what it does, this is what I at the hospital need to do. So make sure that you guys know that when that document is out, that you guys get a copy of it. If you don't have it, say by mid to the end of September, give us an email. I will make sure that I get a copy to you guys. Again, we now do it in PDF form, so it's super easy to send around, but everyone seems to find that document very, very useful. And then one other thing, and I'll touch on this bill in a minute, but I am going to be preparing a webinar on the end of life legislation that passed. Hopefully that'll be available for the membership about a month from now, so mid-July. Again, if you guys are interested in getting a copy of that, or that video, let me know and I'll make sure to get a copy to you guys so that you can see it. And then finally, in case I don't say this at the end of this presentation, if you guys have any particular questions or concerns about anything specific or something general, or you want us to come out and do sort of this broad overview of all the legislation that passed, let us know. Give us a call. We're happy to have a discussion about anything specific, anything general. Happy to get on a Zoom or a Teams chat and connect with you and your team and talk about, again, as much or as little as you guys want. Or I'm always happy to volunteer to go out to meet with the members in person if that's better for you guys at your facility. Let me know if I can make it work, or somebody else on the legal team or the advocacy team can make it work. I think we would be very, very happy to go out and meet with you and meet with your team and meet with the folks in the community and make sure that you guys get the information that you need. So all that to say, reach out, let us know how we can help, and we'll do anything we can. So jumping back into our sort of highlights from the session, again, I can't go into enough detail here with the time that we have, so I'll just do a highlight with the budget, kicking off with the budget here. Thankfully, in the 4 or 5 sessions I've been with THA, it's always been good news with the budget. This year is no different. This session is no different. So, just some general numbers here, but, 80 billion plus in funds from the state to fund Medicaid. A couple of riders in there. We did some really good work with the workforce GME loan repayment programs that we've really been touting these last few years, these last few sessions. Everybody knows that we have nurse staffing and other staffing shortages, and so the legislature took note of that. Again, I've mentioned this in prior episodes, but the nurses right now are getting all of the attention and all of the love. Nothing wrong with that. They did get a good amount of money for that shortage reduction program, but we know that it's more than just nurses. We know that those staffing shortages touch on every department and every area of the hospital. So we will continue to work on that. Just some more numbers on Medicaid and the budget. Again, all good news here: trauma funding, outpatient funding, rural funding, safety net add-ons, all that good stuff. If you guys want to do a deep dive into the budget, let us know. THA, the advocacy and those teams did a really good job putting together an explainer document for the budget. And so we have that available. Happy to send that your way. And then again, if you guys want to have a one-on-one conversation there, we'll make sure that we get those policy folks on the line with you so that you can ask whatever questions you need to you want to have answered. So again, just going through these super quickly, behavioral health, all that stuff, really well accounted for, and a little bit of a feather in our cap here at THA, and making sure that we get those budgetary issues addressed. Jumping into the actual legislation, most of this is going to be legislation that passed. Again, way more bills here that I can do in the 10 to 15 minutes we have together, but I wanted to make sure that you guys have them bulleted out so that if you want to pull them up and read them before we get those documents out to you, you have them. So some of the bigger bills that we were concerned with, House Bill 49, I think this is one that we talked about in prior months. This is a pretty straightforward bill that just allows HHSC to post additional information on the website, on the public-facing website, after a hospital investigation. It sounds scary, but actually we were in support of this bill. We testified in support of this bill. It just puts some very, very basic information out there. The problem with the way the prior statute was interpreted is that HHC really couldn't post much, if anything, on the website. And so it kind of looked like hospitals were hiding the outcomes of these investigations, which of course is not the case. A lot of times we have no problems making that information public otherwise, but HHSC just couldn't do it. So this allows them to post a little bit more information. Again, nothing that's going to keep anybody up at night. Again, it just kind of makes everything kind of look better for all involved. HB 1890, Hospital at Home, that was a big deal for a lot of hospitals that took advantage of that program during COVID. Because that program is a federal program, when the federal public health emergency expired in May, we had to get special dispensation to continue that program at the state level. And so all this bill does, 1890 does, is basically allows for, at the state level, a hospital that wants to continue their hospital at home program, and they get approval from CMS, can do so. So this basically extends a waiver that was granted during COVID and extends it out into the non-COVID, the post-COVID times that we're now entering. Senate Bill 490 and House Bill 711, those would probably be on my top 5 most consequential bills coming out of this legislative session. These are bills that everybody in your facilities really need to pay attention to. Senate Bill 490, quite simply requires a hospital to provide an itemized bill before engaging in any type of debt collection. The idea here is that every patient that comes in the hospital currently, under current law, they can request an itemized bill, an itemized statement from a hospital at any point. This basically requires a hospital to provide that itemized bill, that itemized statement, before seeking any kind of payment from that patient. Now, the bill is, the language in the legislation is ambiguous. And so we are working here at THA, working through this definition of debt collection, because if a hospital does have to proactively send an itemized bill, some of those are super long. We're talking dozens, if not hundreds of pages, depending on the stay. If they have to proactively send that itemized statement for every single patient and every encounter that they have, it's going to be a problem. So if we can narrow that definition of debt collection to maybe like, hey, we're going to send this this unpaid bill to a third-party debt collector or something like that, it may make our lives a little bit easier. But again, right now that language is ambiguous, and we're trying to work through it. House Bill 711, a big bill, potentially concerning to all hospitals, because it does prohibit certain contracting clauses. It basically prohibits hospitals from creating kind of these narrow networks and kind of steering some of those providers and some of those patients into these sort of pre-built networks and setups that hospitals have. So again, I think you guys need to pay attention to that one as well. SB 240, workplace violence prevention, a good bill. Again, I won't dive too deep into a lot of these. 271 and 510, pretty straightforward notification bills if your hospital is subject to a cyber attack, phishing attempt, something like that. This amends the reporting requirements for those hospitals after those attacks. So again, if you guys need to get into those at all, into those bills and get more detail there, let us know. We're happy to send those your way. Couple of things here at the bottom, just again, to keep an eye out, bills that were introduced, maybe had a hearing, didn't actually make it to the finish line. Things like surgical smoke. There's a union out there that's really pushing this issue across the various states, trying to create a very narrow definition and a very narrow requirement for surgical suites to have specialized equipment to evacuate the smoke when it's being created, sort of at the point of contact during surgery. Very, very interesting bill, very, very interesting issue that I've been working on for 7 or 8 years now. I still think it's a lot of stuff that doesn't really matter, let's put it that way. But they're still pushing that issue, and that's the one that I think is going to be coming up here for the foreseeable future. Definition of prudent lay person for emergency care is another big one that we worked really hard on, but weren't able to get over the finish line. So keep an eye out on that one. Some real quick, touching on some of these bills very quickly. Senate Bill 14, another big one that folks are very, very concerned with, probably another one of my top 5. That's that gender transition care bill that has been in the news a lot. And so I'm sure we're going to put out some specialized documentation and education on that one. So keep an eye out there. And then some of these other bills, again, just sort of cleanup bills for other issues. House Bill 1998 is a patient safety bill, basically requiring hospitals to report certain information after reprimands against physicians, things like that. But bills to watch out for next session. Physician non-competes is going to be a big issue. I think that's going to come back next session. Scope bills, of course, those are always coming up. Liability bills, we had some of those bills introduced, but they didn't actually make it over the finish line this go around. This page is bills concerning insurance and payers. Again, just kind of quickly touching on a couple of these. House Bill 2802, managed care organization, texting flexibilities. These are a lot of House Bill 12-month Medicaid postpartum coverage. That's an issue that we've been working on for a couple of sessions now. We thought we had it last session. It didn't actually stick, so we'll see how this one does. Again, if you guys are super interested in these particular bills, let us know. We're happy to get whatever information we can to you guys. And then just some bills with general applicability here, and this is sort of my grab bag. House Bill 4 is a pretty lengthy consumer protection bill. This is one of those bills, a really good example of a bill that has kind of nothing to do with healthcare, but does involve healthcare entities and hospitals. Rep. Capriglione is very big on online consumer protection. He's a big fan of the laws that were passed in the EU and California. So he's been pushing for this type of legislation for a couple of sessions now. This bill, House Bill 4, is not as sort of complex as the California law is, but it's actually modeled after Virginia's law. So it does provide additional privacy protection, that sort of thing for folks in the online setting, protecting individual information, personal data, things like that. It does have specific carve-outs for data that is covered by HIPAA and data that is covered by the Patient Quality Improvement Act. So for the most part, that should apply to a lot of the data that hospitals have. However, this is another one that if you guys are interested or do have some concerns here, make sure that you read House Bill 4, because there is going to be personal data, what they call personally identifiable information, which is things like name, address, social security number, driver's license number, date of birth. That's out there, that's probably existing on your system, that is separate and apart from HIPAA protected data, which is going to be that sort of healthcare specific data, which contains a lot of those same elements, name, birth date, address, but just trying to figure out how this bill applies while at the same time, HIPAA protected data is not covered, is going to be very interesting. So we're going to be working through that one. House Bill 624, emergency transport by firefighters, it does just that. It's really meant for rural areas. Basically says that if there's a firefighter at the scene of an accident, or somebody's having a situation where they need to be transported to a hospital, you call EMS, EMS says, hey, we're not gonna be able to get out there for 20, 30, 40 minutes, whatever it may be. That firefighter can now take that patient to the hospital in their vehicle, whether it's an official vehicle or a volunteer vehicle, their personal vehicle, and have some protection for doing that. Let's see here, Senate Bill 768, again, another just sort of breach of computer data notification bill. This basically says that if your computer system is breached, currently you have to advise the AG within 60 days. This shortens it to 30 days. House Bill 3162, this is that big end of life bill that I talked about at the start of today's session. This is a big bill. It's 40 pages. It does a lot in that end of life space. This is an issue that I've been working on now for about 8 years here at THA. And this is I don't want to say a historic bill, but it's certainly a notable bill in that it was agreed to by about 10 to 12 of the big sort of stakeholders that are involved in these end of life discussions. This is the bill that I mentioned we're going to have a webinar on and make that available to the membership in about a month. So keep an eye out for that. But as you guys work through these end of life issues and the changes that 3162 contain, let us know. This is another one where I'm more than happy to get on a chat with you guys or come out to you guys and kind of work through some of these issues with you. So keep an eye on that one. Senate Bill 29, sorry, I'll probably stop with that one. That's a fairly broad, let's call it an anti-COVID bill. This was a big issue for the governor. He had been saying for even months leading up to the session that he was going to keep the public health emergency, the disaster declaration related to COVID, in place so long as the legislature didn't pass a bill codifying those emergency orders that he issued over the past 3 years. So things like local governments can't require masks, local governments can't require vaccinations, can't shut down businesses, things like that, sort of that COVID backlash. This is that bill. So this is the bill that basically takes all that stuff that the governor has had in place for the last year and a half or so and turns it into law. So we do expect that at some point soon, the governor will stop renewing his disaster declaration. And so anything that's kind of tied to that COVID declaration, like we had at the federal level with the waivers, is probably going to go away. So this is another call. We've been putting these calls out to the members for months now, but if there's anything out there that you believe is tied to that state declaration that the governor has been making consistently and continuously since about March or April of 2020, let us know, because we think that window is going to be closing soon. And so if there's something out there that we're missing, we need to know really soon. But again, that's all that bill is. It just basically says, you know, a local government, a city, a county, or whatever, can't impose some of those mandates that we saw during COVID. So guys, I know that was a lot, but you know, if there's something out there I missed or something else that you guys want to get into, again, I've already said this 2 or 3 times, let us know. We're happy to get that information to you guys as soon as we possibly can.
Well, thank you, Caesar, for putting that together. And it's kind of wild to think that was a very comprehensive list, but from your first slide really represents just a tiny portion of everything that THA has been tracking. So just want to say appreciate your work in particular, because I know you went to the Capitol multiple times to provide testimony. So appreciate that, and all the work that the Texas Hospital Association does on behalf of all of our members. So just a reminder, as Caesar had mentioned, THA is coming out with their budget explainer, their end of session report, and much more beyond that, as Caesar mentioned throughout our conversation today. So I will make sure THT does provide that to our members as well, to make sure you all have the information you need to understand what came out of this legislative session. And a quick plug, once again, Caesar will also be at our healthcare governance conference talking about some of these bills and the repercussions and impacts on your hospital. So you can quiz them in person if you need, or just chat with them there live and in person. So hope to see you there. It'll be in Austin on July 20th through the 22nd. Again, THA.org, THT.org for all your healthcare, politics, and legislative action. And Caesar, just thank you again for bringing us along with you during this session. We really appreciate it.
I know. Thanks for having me again this year. Happy to do it, and hope to see everybody in July.
Sounds good. See you then.